And I'm going to be talking today about changes for physicians, surgeons, and hospitals in the medical Renaissance in England. So, to begin with, in the Renaissance, hospitals started to become more modern. The modern hospitals that we use today were born in the 17th and 18th centuries. These hospitals were funded by wealthy people or by private subscriptions from the local community. Specialist wards, like maternity wards, and specialist hospitals were established to treat certain diseases. This organisation was more effective at curing disease. Reformers, like Florence Nightingale, drove a lot of reforms in hospitals. Following the work of Nightingale, a higher level of cleanliness and organisation was demanded from hospitals. Hospitals began to create pharmacies which could provide medicine. Poor people were often looked after in workhouses. Workhouses were large buildings where the unemployed, ill, or elderly could be looked after. Conditions in workhouses were often very bad, although they got better after 1850. In the 18th century, there was a significant increase in hospitals. For example, in London, there were 5 new general hospitals built between 1720 and 1750. Hospitals like Guy's Hospital opened. This was accompanied by a rise in patient numbers. Hospital treatment was free, but most treatment was still based on Galen's 4 humours. Attitudes to illness began to change in the 18th century, and the idea that illness was a punishment for sin was increasingly less popular. So, to look back over that, we know that following the work of Nightingale, a higher level of cleanliness and organisation was demanded from hospitals. Hospitals began to create pharmacies which could provide medicine. And we know as well that the number of hospitals in the Renaissance increased. In London, there were 5 new general hospitals built between 1720 and 1750. An example of a new hospital was Guy's Hospital, and there was a significant rise in the number of hospitals in the 18th century. So the changes for physicians and surgeons in the Renaissance. Surgeons' status began to improve during the Renaissance, and doctors' training also improved. The ideas of the 4 humours, which I talked about in a previous podcast, and miasmas remained common, but there was growing awareness that dirt and disease were connected. The College of Physicians was set up in 1518. Most British doctors were trained here, and they were still learning Galen's works. In the 18th century, most doctors still believed in the 4 humours, or that disease was spread through bad air, or miasmas. Doctors got a licence if they were trained at the College of Physicians. Quack doctors, who I also spoke about in a previous podcast, did not receive this licence, but some unlicensed doctors were also good doctors. There weren't many changes in nursing in Britain until Florence Nightingale's work in the Crimean War in 1854. After this, Nightingale published a book called Notes on Nursing. The status of nursing was enhanced as they were expected to care for patients and assist doctors. By this point in the Middle Ages, there were 2 main types of surgeon: professional surgeons who were trained at university and were expensive and well paid, and barber surgeons who were unqualified and not very well respected. Surgeon status began to improve, and in 1800 the London College of Surgeons was set up. It created training standards for surgeons. So, to recap over this, we know that quack doctors did not receive a licence to be a doctor. Doctors got a licence if they were trained at the College of Physicians, and in 1800 the London College of Surgeons was set up. So, Florence Nightingale, who we learned about before, who was born in 1820, helped nursing to become professional. Her work with nurses in the Crimean War in 1854 reduced death rates hugely because of her hygiene improvements. And she also published a book called Notes on Nursing. So the ideas of the 4 humours and miasma remained common in Renaissance Europe, but there was growing awareness that dirt and disease were connected. So, to look back over what we've discussed so far, we know that the modern hospitals that we use today have their origin in the 17th and 18th centuries. Specialist wards and specialist hospitals were established to treat certain diseases, and hospitals were funded by wealthy people or by private subscriptions from the local community. Okay, so that's all for physicians, surgeons, and hospitals. Thanks very much for listening.